My name is Dr. Modou Bella Jallow. I'm an internal medicine resident in the Edward Francis Small Teaching Hospital, which is the biggest hospital in the Gambia, managing all the complicated cases in the country. I got the Merck Foundation Capacity Advancement Program, on which I studied the Postgraduate Diploma in Respiratory Medicine in the year 2021-2022. So to begin with the importance of the respiratory program I did, just to remind that it happened during the COVID pandemic, and this have come at a right time when everybody was trying to learn something about the respiratory condition, and I was fortunate to get this scholarship which I couldn't turn down, and I could tell you the impact it have on my career development and also on the patient care of at the hospital. It's immeasurable in the fact that during this period I was able to learn from well-advanced treatment methodologies in other countries, especially the lecturers who are lecturing have been working in advanced countries like the UK for many years. And the two areas that have really impacted me is the management of asthma when it comes to low-income countries like the Gambia, which usually we don't use any guideline, we just base it on our own experience. But from this program, I was able to get the British Thoracic Society guidelines, which have really improved my patient care. And the second thing is also the cancer management. We all know lung cancer is the most common cancer in the world, and it's the deadliest cancer of all the cancers. And countries like the Gambia, we don't have those facilities that will do diagnosis, but the other downside of it also, we don't even get the basic knowledge, and I was opportune to get this knowledge based on my exposure through the program, and I am forever grateful with Merck Foundation for giving me this opportunity. And I hope through this more Gambians and other Africans will also benefit, so that at the end of the day we will be able to get these technologies to our country, because we've already got the needed knowledge to work with the in management of lung conditions in our country. So with regards to the achievement of this postgraduate diploma in respiratory medicine, I could begin by saying that during the time I was studying, we were not having the most basic test, which is spirometry. And through this training, we were able to get a consultant from Nigeria who came, and through him and us being trained, the hospital were able to buy spirometry. Because of that, we've been diagnosing more patients with obstructive disease, not only asthma but also COPD, which I think is because they have people that have knowledge in these areas. That is why they are bringing the technology. So I believe the bigger impact is that if you have the human resources in place, usually the country is always willing to get the material resources to expand care. The second thing is also we've been doing outreaches, that is going to communities, giving them free outreach, which is to reach out to remote areas where most of these cares are not available. So through the charity work we've been doing as the doctors group, we take our weekends, Saturdays usually, we go to rural Gambia or visit the regional hospital and give them the needed care. And it doesn't only stop at respiratory conditions. We all know Africa is one of the countries which are affected by TB, asthma that is not well controlled or well managed. So most of these people have been benefiting, and all this is because we had the knowledge, and now we are spreading it to the population, and also training our junior doctors, because as a resident, the young doctors that are working under us are usually being monitored and coordinated through training program. So I want to take this opportunity to send a special gratitude and thank you to the CEO of Merck Foundation, Dr. Rasa Khalid, who have been doing an inspirational work not only in India but also around the world. And I have directly benefited from that work, and I continue to pay it forward to people that are in need of these services. And I hope through her work and through her charity, more and more people will be able to benefit. In the long run, many patients will get the needed care in the globe. So just to conclude, we want to thank all the people that are also working behind her to make sure that all these things are in success, and we wish them best of luck, and we hope that this is just the beginning, and Merck Foundation will continue doing exceptionally well and will be a household name for all the in every part of the world. Thank you.